What is a microdiscectomy? A microdiscectomy is the least invasive method of repairing a disc herniation, usually in the lumbar spine. What is a lumbar disc herniation? The lumbar spine is composed of 5 vertebral bodies. Each of these vertebral bodies is separated by a disc, and down the middle of the vertebral bodies is the spinal canal where the spinal cord travels. At each disc level, a nerve is given off, and all of these nerves join together in the buttock to form a larger nerve known as the sciatic nerve. A disc herniation is when a piece of the disc breaks off and pinches one of these nerves as they exit the spinal cord. A herniated disc normally affects the nerve that crosses the disc space and exits at the next disc level. When the nerve is pinched, it produces pain in the back, buttock, and down the leg, which is known as sciatica. A pinched nerve can produce pain, numbness, tingling, burning, and other symptoms in the leg. Microsurgery typically involves the use of specialized equipment such as retractors, tubes, or endoscopes. The retractors and tubes are typically used posteriorly or behind. A small incision is made in the skin. The tissue is dilated as the tube is advanced to the disc. Using special tools and a microscope, the damaged piece of disc is removed and the pressure is relieved from the nerve. Endoscopes use cameras and normally enter the spine from the side through the neural foramen. A disc is composed of a strong outer ligament, and the inside is filled with a jello-like material. When the jello-like material leaks out, that is a disc herniation. Removing the disc herniation provides a significant amount of immediate pain relief. It is important to keep in mind that the associated tissue takes a few weeks to heal. The nerve is still swollen, the disc is still rough. As you move, the nerve is going to move, and you will get some pain in the back, buttock, and down the leg. This is normal. It's usually relatively mild, but it can be scary because there's always the constant thought or fear that that horrible pain is going to come back at any time. In spite of your fears, you do need to stay active. We want to keep the nerve moving so that that area does not get enveloped in scar tissue and so that the nerve does not stick to the disc space. In time, the disc will heal, the swelling will resolve, as will your pain. A microdiscectomy is a surgical procedure and therefore carries all the typical risks that would be associated with any type of surgical procedure, along with, number 1, the possibility of a recurrent disc herniation. A microdiscectomy is done in an attempt to salvage a damaged disc. A disc that is damaged and has herniated once can herniate again. The good news is these occur infrequently and in most cases can be repaired with a subsequent microdiscectomy. Number 2, a pars defect or spondylolysis. In order to get to the disc, some of the bony lamina must be removed. If the bone is soft, it may fracture at some point after the surgical procedure. Without the stabilizing effect of that joint, the disc space may become unstable and painful. If it is symptomatic, in most cases, it's best treated with a fusion. Once again, this is very rare. For more information regarding outpatient, minimally invasive lumbar spinal fusions, remember to watch some of our other videos. But thank you for watching this video. Remember to give us a thumbs up and subscribe. Tell your friends and neighbors to watch. Share the video. Thank you.